Hello everyone, I am Dr. Ruchi Sofat from Dr. Rama Sofat Hospital and Ruchi Test Tube Baby Center, working as an infertility consultant here. Today I am here to share information about one of the most common complications I get to see in my OPD patients, namely PCOS or Polycystic Ovarian Syndrome. What is PCOS? PCOS is the most common hormonal abnormality found in reproductive aged women. The incidence rate is about 10 to 25%. Women with polycystic ovarian syndrome may have infrequent or prolonged menstrual periods or excess male hormone levels. The ovaries may develop multiple small collections of fluid within the follicles, as a result of which they fail to ovulate regularly. Now, what causes the PCOS? Now, what causes this polycystic ovarian syndrome? The exact cause of PCOS, to why these women develop polycystic ovarian syndrome, is not exactly known. What we can hypothesize is that it is an amalgamation of genetic factors as well as lifestyle factors. There is an increased androgen level and insulin resistance in the body of women who suffer from polycystic ovaries. What is insulin resistance? Insulin resistance means that the body is not sensitive to the amount of insulin which is being produced in the body, so that the body is forced to produce insulin to keep the same glucose under check. And what are the androgens? Androgens are the male hormones which are present in a normal female also to an extent, but in polycystic ovarian patients their levels increase considerably, so much that the females start developing male features like excessive body hair, facial hair, acne, oily skin, irregular menstrual periods, and so on. Now, how do these patients present themselves within the OPD, or what are the common symptoms of polycystic ovarian syndrome? These patients normally present with irregular menstrual cycle, and by irregularity I mean that the range of the menstrual periods may vary from being totally absent to being prolonged, that is more than 35 days. How do these patients present themselves within the OPD, or what are the common presenting complaints of patients with polycystic ovarian syndrome? The patients usually present with irregular menstrual periods, and by irregularity I mean the periods cycles may vary from being irregular, that is prolonged, that is more than 35 days, to being totally absent. As a case of female infertility, where due to increased androgen levels, there is a problem with the ovulation, as a result of which pregnancy cannot take place, and the periods are irregular, pregnancy cannot take place. They may also present with obesity or increased facial hair growth, acne, oily skin, or sometimes thick velvety patchy dark skin, mostly near the neck, called acanthosis nigricans. What are the long-term risks for patients with PCOS? PCOS is associated with insulin resistance, which may result in type 2 diabetes in the patients at a later date. It may cause obesity, which is an important risk factor for cardiovascular diseases. It may also result in irregular or absent menses, which is an important contributing factor for endometrial cancer. How do we test patients with PCOS? If we talk of the blood test, it would include evaluating the ovarian hormones, that is FSH and LH levels, the testosterone levels, thyroid panel, blood sugar levels, and also the total cholesterol level. A transvaginal ultrasound is also used to determine the size of the ovaries and the presence of fluid-filled cyst, which may give confirmation of the problem. How do we treat patients with polycystic ovarian syndrome? Usually the treatment is tailored according to the requirements of the patient. If the affected patient is a young girl who only wants regularization of her cycles, we put her on oral contraceptive low-dose pills which can correct the hormonal imbalance, decrease androgen levels, and regularize the cycle. But if the patient is desirous of having a baby, we usually put the patient on fertility management. But the single most important factor that can improve the outcome of any patient is the lifestyle modifications. What we tell the patient in lifestyle modification is change in the dietary habits and exercise, daily exercising. Even if the patient decreases 10% of the total weight, It can have significant improvement in the ovulatory functions of the ovary. As a result of it, she may have a regular period, and the problem of infertility may get solved spontaneously. I hope you got some insight into the complicated problem a patient of polycystic ovarian syndrome faces. If you have any query related to this problem, or if you want to consult me or one of my doctors, feel free to call on the numbers mentioned down. Thank you and have a nice day.